Hi, it's Pat Cruz from All Care Physiotherapy, here to discuss some of our fantastic treatment techniques we use in the clinic. So today we're going to talk about why we mobilise the cervical spine or the neck. So here's a model. Now our neck is made up of 7 vertebrae, and it's actually 4 on the upper thoracic that's considered the neck as well. And when you, for example, turn your neck, all these little vertebrae have to rotate on each other. They need to slide quite nicely all the way down this, what we call articular pillar. Now the problem is if you end up with neck pain, you would normally end up with some sort of stiffness or restriction in this row of joints, where part of our treatment is to A, assess where the problem is, B, start treatment. Once we start freeing this up, your neck tends to move, which results in less pain and gets you on the path to recovery. So we're going to show a couple of the techniques that we use today. Caitlin has kindly volunteered to be our patient. So the first one is what we call an anterior mobilisation. So what we're going to do is we're going to use our fingers to gently move these vertebrae, one on the other, down this articular pillar. Okay, so it's a nice comfortable technique for the patient. All I'm going to do is support the head, gently pop my fingers in here, and we're going to gently move some of these joints. So we assess, and if we find one that's not moving properly, we can just use the fingers and gently move these joints. You will feel it because we will actually be moving a stiff joint that needs to move. Okay, and that will tend to increase range when we tend to sit you up and reassess it. So the other one I want to do, I'm going to get Caitlin over onto her side. And this is one of my favourite techniques. So if we look at the side of the neck, we can actually come in with our fingers and gently move right where that joint is. Right, and the nerves are here, so we're nowhere near that. But we can gently move one vertebrae and the other, which really gets that rotation going, and even this side bending movement. Once again, nice and comfortable for you. So all I'm going to do is come with my fingers and we can find where those joints are, and we're going to gently move those vertebrae one on the other. Find the really stiff one, and that's the one you'll find that we'll concentrate on, and really just gently move it, get it going. Okay, and then when you tend to sit up and we reassess, you'll see you'll have increased range, okay, which will help you on your path to recovery. So there you go, there's 2 of our great techniques that we use in the clinic every day, and you'll have a little bit more idea about what we do here at All Care Physiotherapy. Thank you.